Under here, here's, you feel these right in there.
Yeah.
A few more. Okay.
Like we had this one removed, but there was just like, there's not much we could do for those, so.
Alright, I think we're done. Let me see your teeth. Okay. I'm not gonna work on your teeth right now, okay? But thank you for letting me work on you, okay? You're a really good dog. You're so brave to let me do some things. So we finally have the Animal Cracker t-shirt. You can find the link in my store section of my YouTube page, Animal Cracker, and then you'll see store. Just click on that and it'll bring you a direct link. It comes in all sorts of colors. It comes in men's cut, women's cut, has pink, blue, black, white, and we also have mugs. It does send to Europe also, so it should be accessible for those that are connecting that way. Isn't that cute? All right, so we have Jaydah here today. Here, let's get lower so we're all at the same level. And Jaydah is a miniature English Bull Terrier. She's 15 years old. If you haven't noticed, she has coloring white. Would we say that's true? And a beautiful face. So we have her here, and she's got a lot of arthritis. You'll see when you see her from the side, she's really shaky here. So hold here and pass me the camera and I'll catch it over here, and then I'll pass the camera back. And you can see her her back leg. Here, let me zoom out a little bit. And you could stay where you are. And we're gonna just see some quivering here. I'm also looking respiration. So her respiration is a little fast. She also here, look down really low. She gets these granulomas or these hot spots, and it flares up in the summertime. So, heat might be a component. Her vet says allergies are a component. What's interesting, and you can look up at me for a second, what's interesting is some animals do respond to chiropractic as a component of that. So I don't want to say that the cause is from the nervous system, but it's a component. And sometimes it just adds to it. So if you could take pressure off the sciatic nerve, which comes down this way, the femoral nerve coming down the quad, you'll get a better healing response time. Also think about this, like with the dog, especially on the front feet, if there's a pinched nerve, and we just call that pinched nerve because it's a common colloquial term, but the nerve actually doesn't precisely get pinched. So if someone's watching this with that type of medical training, I'm saying that in the colloquial sense, not that it literally is pinched between two bones, because what happens is when bones shift out of their normal position between the one above and below, it creates a cascade of events. It pulls on the muscles and the ligaments inconsistently. It causes edema and inflammation in the area, and that pressure in that motor unit of those two joints will also irritate the nerves, and then we call it a pinched nerve. But when someone says my neck went out or my back went out, where did it go? It didn't really jump out of their skin. So we're talking millimeters. There was a study done at the University of Colorado back, I think in the 1960s, by a Dr. Su, S-U-H. You'll probably look that up and tell me I have that all wrong, but that would be good because that would just help me. I hadn't looked at the study in years. But he said that the weight of a dime, the 10-cent coin here in the United States, on a nerve can reduce function 20, 30, 40%. So we don't need a lot of pressure on a nerve to irritate it or reduce function. And so getting back to the front legs of a dog that's like licking until they have raw skin, sometimes that's coming from a nerve irritation. So if you've ever had like sciatica going down the leg, or numbness from a pinched nerve or a disc injury in your neck, and your thumb goes numb, we don't normally lick as a reaction to something, but what do dogs do? Dogs will chew on it, they'll lick it because it feels weird, or it's irritated, or even if it has pain, they'll bring that to it. And now the skin is irritated, the skin breaks out, the skin gets a rash, and it has a constant irritation because there's a nerve component. So when I see this type of lesion, I'm always thinking, can I add to the situation of improving it? And very often you'll see an accompanying nerve that is related to it that could use a little less stress. So that's the type of thing I'm going to look for today. I'm going to look to see some of the nerves that go down the leg. I'm going to look at the neck and cervicals. We can't make this dog not 15 years anymore. She is 15 years old, and she does have, like, you know, she's had a long life already, but let's make her comfortable. So that's what I think about, and I want people to really have that clarity, because if they watch this, they're like, what is he going to do, some miracle adjustment? No, we're working on an elderly dog and just trying to make it comfortable and with gentle technique. And by now I have a lot of videos up with elderly dogs and elderly horses, and you'll see that that's mostly the goal. So what else do you want to tell us about the health? And this is Julio here.
Yeah, like
he's
you
the
said,
dad. You've had
15 years.
15 years.
Yeah, since she was 4 months. So basically, like you said, anything that I could help her, you know, live her life a little bit more comfortable, that's the goal here.
Okay.
So I don't know if you want to get a close-up as far as like
the shaking?
Yeah. Right.
Yeah, so let's try it one more time. So you stay over there, camera. Roger is on camera today. And you'll see a scar here, and that was a lipoma, which is like a little fatty, benign cyst. Humans get them quite a bit, so do dogs. We'll see the tail wrapped under. Was she ever a tail wagger, or is she always... Because a lot of times that's stress.
Most of the time when she's in a stressful situation, she's like this, tucked in. But usually it's just...
But when she was younger, she work the tail?
Yeah.
You know, when she's stressed out, you can hear it a little bit in her breathing. She's uncomfortable standing. You said sometimes she wobbles over and wants to sit, right?
Yeah.
And okay, hi,
it's hard
baby.
for her to sit. It's really hard for her to sit.
And you know, she's got a lot of musculoskeletal issues. So I just want to ask you, can I work with you today? Okay? I'm going to give you a very gentle adjustment. I'm going to look at your upper cervicals. Let me just touch them really easy. Okay, yeah, you could do a little work up at the atlas. I'm coming down just with soft touch here. And you can go to daddy. And I'm going to come down this way. And I already found something mid-thoracics, thoracolumbar junction here, lumbars, and around the tail. And we'll also see what's going on with the glutes. Hamstrings have loss of muscle. The right side is tighter. The left side's a little flaccid. Quads are tight and rigid, and also a little loss of muscle mass. And so we just want to see all over. So what I'd like to do is give you a little adjustment today. What do you think of that?
Sounds good.
Want to check with your dad? All right, let's start there, okay? And I always like to ask, because I feel like number one is be respectful of the animal. We need to, whether it's a horse, a dog, a cat, a pig, a chicken, we need to move into their space for just a moment and gently and humbly ask for permission. So that's what I'm trying to do. And on some level, maybe she can read that I'm here to help. That's what I hope. All right, so I'm going to start following her around and seeing what she'll give me. The first thing I'm doing is I'm checking the space between the wings of the atlas, which are the bony transverse processes on either side of the top bone. And you'll sometimes feel a lack of spacing between the edge of that bone and the bottom of the skull. And I immediately can feel that she's very closed down on the right. So in a minute I'll come to get that, but let's just keep going. Let me check up here at the muscles. So now I'm checking the muscles between the base of the skull and where it meets that top bone. So I'm just moving more to the top. On a horse we call that the pole, and we don't say that on a dog, but to me it still feels like the same part of the body, right? Because this would be the withers of the horse, T3 through T8. And so I'm going to come down here, and let's just feel some of the neck now. And I have to move a little fast with her because she doesn't want me doing this a long time. So I found one at C5 on the right. So I have C5, I have a superior atlas on the right. I haven't started yet, I'm just observing. Here's that mid-thoracic one. So let's count that. 1, 2, 3, 4, 5, 7, 8, 10, 11. T11. And then her leg's really shaking. So I'm going to do that one first. So because of her instability in 4-point stance, I'm going to really push up on her rib cage. And I'm going to adjust this now. Is that okay? And you might hold her head just a little bit so she doesn't turn and bite me. I gotta do it this way. Got it. All right.
She reacted to that.
She felt that
She
one.
looked at me
And I
like,
can feel
"What
it
was
like
that?"
click into place, which is really nice. So now that I'm up here, I'm going to go back to the atlas, and I can feel it now. And I'm going to just pull down on that side because it's really wedged tight against the occiput. So I'm going to just come in here. Got it. Okay. And while I'm over here, I'm going to get C5 on the right that I found before. Got it. And let's let her walk around and see if she wants to just move away and think about that for a second.
Won't be surprised.
So I did T11, C5 on the right, superior atlas on the right. Let me check my work. So I'm going to come back in, check the spacing, see if it's even now. Ooh, it's even almost more on the right than the left now. Okay, let's turn her around. Bring her back, we'll reposition her. Good, C5's back in. This one went in perfect. I'm going to do a few more while I'm here. Got it. That was L6. Here's sacral base. Got it. Got it. Now I'm going to bring her leg up, okay?
Okay.
Okay, just a little bit. That one's very weak. That one's better. There it comes. One more. There we go. Now just hold it here and stretch it, okay? And then let it go gently down. Beautiful. Now we're going to do the other side, okay, babe? I'm going to lift this one up. And I'm just going to hold it and stretch. Hold it and stretch. Hold it and stretch. Good. Now I do want to see where the nerve goes down that leg. We have the SI joint here. These two landmarks are called the tuber sacralis, which is these high points where the ilium meets the sacrum. And they're right here and here. And you can feel these little bumps here. I wish you could feel these. And then in between is the little sacral base. And then up here are the lower lumbars. And right here to the left of especially L6 is a high posterior left L6, and that's where that sciatica emanates and comes down the leg. I can even feel this clicking already. But so I'm going to adjust that one too. And ooh, did you hear that click?
I did.
That one made a loud noise.
I did.
Now I'm going to pull the tail up. You can see that there's a lot of irritation on the tail. Do you ever see her working on her own tail?
No, she's had that
She's
scar
had
for
that?
a while,
Yeah.
and the hair just never grew back. But I've seen a bunch of other bull terriers,
Yeah.
same issue. I don't know.
So put your hand lightly here and watch this. Even just moving this, you'll feel it clunk around a little bit under your hand. Do you
Right.
feel that move a
Yeah.
little bit?
Yeah.
So her that's her ilium, and her ilium is a little misaligned. She has a posterior ilium on the left, and I'm going to just adjust it down and away on a 45-degree angle this way. But first I'm going to stabilize under here. Let's go through this way. I'm just going to hold that in. No, didn't get it. Switch hands. I didn't get it. Got it. All right, that's good. That should help the nerve going down the leg because I just got in where it was irritated. Now, she's still breathing heavy. I want to do something like, it's more of a pressure point where I'm going to come in off the rib. I do this on horses too. And I'm going to just do this little hold release point to get the muscles of respiration. I'm on the rectus abdominis and I'm just holding under here, and you could see maybe come between my hands And I'm holding these pressure points.
Relax. Okay.
And she's definitely revved up from this work. Another thing I want you to notice is her narrow base. So she's got has a lot of instability. Okay, and that's the tail. Legs, I'm going to massage the quads a little bit. I'm up in here. I'm looking for a spasm. So I'm all the way under here. My finger is this deep. And I'm pushing back in from medial to lateral on the muscle. And I'm up by the iliopsoas muscle now, pushing in. And that flexes the hip forward towards the rib cage. And I'm on a cool pressure point. It's a little tender on her. She's going to increase her respiratory rate. But it's worth getting this. And I don't have to adjust this. This is more of a release, hold and release. So I'm going to hold it, hold it, hold it. I'm picturing what it looks like because I can't see it, so I have to picture where my hand is. And then I'm about to let go. I feel it soften, and then I release it. Now I'm going to check the quad afterwards. Now I check the hamstring. Okay. The more medial line of the hamstring is semimembranosus. That feels a little spasmy, so I'm going to hold a pressure point on her semimembranosus part of her hamstring. And you can see it, her leg go when I hold this. Do you see how much the leg twitches out right here? Because I'm on a real bad trigger point. And my finger is up under, not in her butt, but right near her butt. And I'm just giving that a little pressure release because it's in such spasm that it is putting a lot of stress through that leg. And I'm about to let that go and let her quiet down a little bit. Now I want to go over to the other hamstring, the left side, and just see what that feels like. And you can see a little better now. So down here is the hamstring, and she has like a little bump on her butt too. Did you see that little lesion?
Yeah.
What did they say that was? What did they tell you? Do you see it under here? Look, everybody, right there. Okay. So now I'm going to work into the glute and hamstring. So I have one finger on the hamstring, one up on the glute, and doing that together at the same time, holding those pressure points. This is not going to be a physical chiropractic adjustment. This is more of a massage. So right now I'm doing canine massage, working through. If you've seen one of my videos I've done on the dog Ruby, the Rottweiler that kisses me the whole video, that's a fun video, and we silly and have fun but do some good work. This one, has a more serious tone. There's no jokes to be had today. We're not trying to make you laugh or be silly. And I'm really concerned because I know I'm holding spots that's making her whole body quiver. And so, but guess what? It's releasing and relaxing. It's still twitching, but I got this muscle. Look at the muscle here. The muscle is now looser. It was taut as rawhide. And there's the hamstring. The hamstring feels good on this side, so I'm going to leave that alone. But then the quad on this side, and here's the quad all the way up here, because remember the quad's at the bottom of our hip. So here's our hip, and then we go down. So now I'm up in the quad, and the quad on the upper left up here has a, right here has a big spasm. So I'm going to hold that. And good. May I have your leg, please? May I have this leg? There we go. So I'm going to bring the leg up a little bit. That joint is really locked, right?
Yeah. The back legs are.
Yeah, they're stiff. So these are all locked down. I'm going to come up into the pelvis again, contacting the iliopsoas on the left, which is your hip flexor, part of the hip flexor complex, and then feeling the rib cage, palpating underneath, And I feel there's a bunch more little lipomas, so little fatty cysts around
she has
her
a
chest. Here, give me your hand under here. Here's, you feel these right in there.
Yeah.
A few more. Okay.
Like we had this one removed, but there was just like there's not much we could do for those. So.
All right. I think we're done. Let me see your teeth. Okay. I'm not gonna work on your teeth right now, okay? But thank you for letting me work on you, okay? You're a really good dog. You're so brave to let me do some things. And I think we're done. I did some muscle work, I did some adjustments, and we're mostly just trying to get her to relax a little bit. One of the reasons she has a hard time sitting down is she has no joint mobility in the back end. So they're stiff. These are like, these back, what's equivalent to like an ankle, is locked. These are locked and calcified even. But back up on me. So thank you everybody for watching this. Leave comments for Jaydah. She's absolutely lovely and she reads her comments. So we want you guys to all wish her a good day and good luck with her health. And she's lovely, isn't she? So thank you. Thank you.
Thank you,
Okay.
Doctor.
And then walk this way. Cut.